Many parents miss the early signs of autism because they can be incredibly subtle. Even experienced professionals sometimes overlook them. Yet identifying these signs between 18 months and 2.5 years can make a life-changing difference in a child's development. A pediatric occupational therapist highlights 10 early behavioral signs that can help parents observe possible symptoms of autism at home and seek timely help. Sign 1. Lack of eye contact. Eye contact is one of the first ways children connect with others. During play, if you roll a ball to your toddler and stop, most children will look at both the toy and you, as if to say, "Your turn." This is social eye contact. If your child only stares at the toy without looking to you for connection, it may indicate difficulty using eye contact to communicate, one of the earliest red flags of autism. Sign 2. Not sharing interests. Typically, developing children naturally want to share discoveries. For instance, when you ask, "Where's your car?" a toddler might point to it and look back at you for acknowledgement. If your child points without checking your reaction, or doesn't point at all, it may signal challenges with shared attention, a key social skill that helps develop communication. Sign 3. Limited use of gestures. Gestures like waving, clapping, or raising arms to be picked up are a child's first form of language. If your toddler rarely gestures or only does so when prompted, say bye-bye, it could suggest developmental differences. Gestures lay the foundation for speech and emotional expression. Sign 4. Not responding to gestures. Children should understand gestures as well as use them. When you point to a dog or wave hello, they should follow your motion or respond with interest. If they focus on your hand or don't react, it may reflect difficulty interpreting nonverbal communication. Sign 5. Inconsistent response to their name. By 1-year-old, children usually turn when their name is called. If your toddler often fails to respond by the second or third time, and hearing loss has been ruled out, it may indicate social communication differences often seen in autism. Sign 6. Limited or delayed language. By 18 months, children typically have at least 3 meaningful words. By age 2, they know around 20 to 50 and begin combining them. More milk, big car. If your child rarely uses or understands words naturally or doesn't engage in playful back and forth babbling, it could signal a language delay, one of the most common early signs of autism. Sign 7. Not sharing excitement or joy. Children often share joy, showing you a toy, running to you after discovering something new, or checking your reaction. If your toddler enjoys things alone, avoids eye contact, or doesn't wait for your response, they may be struggling with social sharing, another early sign. Sign 8. Repetitive or limited play. By age 2, children begin pretend play, feeding dolls, making car noises, or cooking with toy food. Autistic children may engage in repetitive play such as lining up toys, spinning wheels, or fixating on specific parts of objects, showing limited symbolic imagination. Sign 9. Lack of imitation. Toddlers learn through imitation, waving, brushing hair, or clapping. If your child watches you but doesn't copy simple actions, it might suggest differences in social learning or attention. Sign 10. Repetitive movements. Repetitive behaviors like hand flapping, rocking, or tiptoe walking can help children self-regulate. While occasional stimming is normal, frequent or prolonged repetition may point toward autism-related sensory needs. When to be concerned. Seeing 1 or 2 signs isn't cause for alarm. Children develop at different rates. However, if several behaviors occur consistently, speak with your pediatrician or developmental specialist. Keep notes of what you observe. Early evaluation can lead to crucial early intervention services that greatly improve social and communication skills. Supporting your child at home. Parents can nurture connection and communication through small, everyday actions. Use simple, expressive language and gestures. Celebrate all attempts to communicate, even babbles. Encourage imitation and pretend play. Respond warmly to eye contact and gestures. Avoid pressuring or comparing your child to others. Final takeaway. Recognizing early signs of autism isn't about labeling your child. It's about understanding and supporting them. Parents are often the first to sense when something feels different. Observing how your toddler uses eye contact, gestures, play, and communication can reveal meaningful clues about their development. Early awareness leads to early help, and with the right support, children on the autism spectrum can thrive, learn, and build loving, fulfilling connections.